I was carrying 2 IV poles and 2 heavy medical carts down 3 flights of stairs, by myself. My children and the home health nurse were depending on me. Did I inventory their medical supplies to make sure they had what they needed? Did I sit out their medication in time so it was at the right temperature? Did I remember to give them their pre-medication to prevent possible side effects? I felt like I was drowning. 7 years ago, our lives were turned upside down. My 9-year-old Maddie had a sore throat for 2 days, then woke up with a multi-motor body tic and the inability to take more than a few steps without falling. Our pediatrician agreed something was very wrong, but lab work did not show anything. She ordered an MRI, but we endured 3 months of calling area hospitals to make that happen. Each day brought more seemingly unrelated but alarming symptoms. I no longer recognized my own child. I bounced from specialist to specialist. We finally received a diagnosis but had no idea of the battle ahead. My child's brain was on fire and no one knew how to help. After her diagnosis, her infectious disease doctor and I realized her younger brother Miles also suffered from autoimmune encephalitis. I was a mom with 2 children I could not protect from the autoantibodies ravaging their brains. But I knew I had to figure it out. They needed their childhood back. Every spare moment I spent researching treatment options. We started with a combination of antibiotics, then moved onto a functional medicine doctor over 5 hours away and not covered by our health insurance. I watched my children slowly deteriorate. They were taking over 20 pills per day and we were miserable. Every time they got sick, we were right back to all of their initial symptoms. Based on my research, I knew what we needed to do. They needed a 48-hour hospitalization for an IV infusion with a myriad of possible side effects every month for possibly the rest of their life. Insurance denied coverage. Their medical team and I worked relentlessly, and after a year, we finally got approval. Today, my children have gone from barely making it through their school day to enjoying a more typical childhood. My experience felt isolating, but I found solace in the nurses who helped me through the endless tightrope walk of hope and fear. They took time to understand my children as individuals. They made me feel like we were in it together.